DPV Health acknowledges the Kulin Nations as First Peoples and Aboriginal traditional owners and custodians of the lands and waters where this podcast has been recorded. We pay our respects to elders past and present and anyone joining us today.
Welcome to the Escape the Vape podcast series created and produced by DPV Health. Young people deserve a healthy life where they can grow, learn and thrive. This sets a strong foundation for the rest of their lives. But the tobacco and vaping industry are threatening the health and well-being of young people through their addictive, harmful products. They have created non-therapeutic vapes with the intent of hooking a new generation on nicotine. To address this, DPV Health have created the Escape the Vape podcast series to educate adults in the community on the various harms associated with vaping and how to support the young people in their lives. DPV Health is one of Victoria's largest independent, not-for-profit community health organisations, providing an extensive range of health and wellbeing services in the cities of Hume, Whittlesea, Mitchellshire, Banyule and Darebin. Our purpose is to support you to live a happy and healthy life through the provision of inclusive, locally based health and wellbeing services. My name is Rebecca and I work in the health promotion team at DPV Health. I'm looking forward to hosting this podcast series and having meaningful conversations with our wonderful guest speakers. In the last episode, Dr. Farhan went through an overview of vapes, including the harmful ingredients, health impacts, and how GPs can support in quitting smoking or vaping. Please go to our website to listen to this episode. On today's episode, we'll be talking about the sneaky and unethical marketing tactics of the tobacco and vaping industry and get an understanding of the new laws on vapes. We are joined by two special guests. Alecia Brooks is the manager of the Tobacco Control Unit at Cancer Council New South Wales that works to influence tobacco control policy in the state. Alecia also is the chair of the Federal Tobacco Issues Committee that works towards the National Tobacco Strategy. And lastly, she is a co-investigator of Generation Vape, a project that researches various topics related to tobacco harm to advocate for policy changes. Thanks so much for joining us today, Alecia.
Thanks for having me.
And we are also joined by Rachael Andersen, who is the director of QUIT. Through QuitLine services and extensive cessation support information, resources and evidence-based tools accessed through quit.org.au, QUIT provides direct support for people who smoke or vape to quit. QUIT also supports doctors and health professionals to help patients to quit and continues to advocate for legislation to protect Australians from the harms of smoking and vaping. Thanks so much as well for joining us, Rachael.
It's a pleasure to be here.
Great. So in the last episode, we discussed how vapes were first created as a tool to help people quit smoking. How has this ended up with young people aged 14 to 24 having the highest rates of vaping across all age groups in Australia? And I'll hand that one to you, Alecia.
No worries. Look, tobacco and vaping companies have always pushed that line that vapes were created to help people quit. But we know in Australia the highest users of vape products are actually young people, 14 to 24. And that's because vapes are designed in a way that appeals to a young audience. They're brightly coloured, their designs are very youthful, they're using, fruit and lolly flavours, and all of those things drive up that use by that demographic. And big tobacco companies, many of which have shares in vaping products as well, they have deep pockets, and they are purposely targeting those young people to hook a new generation to nicotine with their toxic and highly addictive products.
Yeah, okay. So I guess it's important to learn straight off the bat that the vaping industry really is sort of the same as the tobacco industry. Is that right?
Look, there's a lot of similarities and crossover between the industries. There are some standalone vaping products or vape industry products, but generally there is a lot of crossover, and you see big tobacco has got a big share in the vape and nicotine game.
Yeah, okay, that's super interesting. So, Rachael, why are the tobacco or vaping industry doing this? Why are they pushing these products?
So we've seen over decades that the public health experts, that we've become more aware about the link between smoking and health harms and how it kills. And as a consequence, the Australian government and governments all around the world, they've implemented really strict laws and policies to drive down rates of smoking. And that's also to prevent uptake, to support people as well to quit. So these policies have been incredibly successful, and we've seen things like plain packaging here in Australia. We've seen really extensive social marketing campaigns, and the increasing cost of cigarettes via tax excise through the Australian government federal laws. These have all been really successful in driving down prevalence, and the revenue for tobacco industries in countries like Australia has decreased. So because of that, because of the declining smoking rates in many developed countries, big tobacco's really had to pivot, and it's really had to innovate around new products and looking to develop new products to addict the next generation of customers. And so that's where we see vaping really enter the market. And it's entered the market now, and we're seeing other novel products like nicotine pouches also entering the market as well.
Yeah, okay. So essentially, the tobacco industry has lost a lot of revenue, and so they've now pushed vapes and nicotine pouches on young people to make more money.
That's correct.
Yeah, okay. So, Alecia, can you touch on how the tobacco and vaping industry are actually targeting young people?
No problem. Look, there are lots of ways that the tobacco and vaping companies target young people. I think the most concerning examples are through manipulative marketing tactics. And this is, speaking to what Rachel's talked about, this is around how they've evolved or changed those products over time. So smoking is at an all-time low for young people in Australia. So the industry, as Rachel said, pivoted and began developing vapes that smelled like lollies, were more easily concealed and more directly appealing to younger people than the traditional cigarette, that also came with it a lot of health knowledge and harms that young people were already smart and across. So this is a new product that could be, shaped in a different way for young people. Not only did they begin pushing vapes, but they've also expanded their products to include things like nicotine pouches. And if you haven't heard of them before, they're small little bags designed to be placed in the person's mouth between the gum and the lip, and they've got a really high concentration of nicotine. And they come in a range of flavours, and they're quite similar to vapes in sort of that respect. They're also illegal in Australia. So data from Generation Vape shows that 1 in 5 young adults who currently smoke have used nicotine pouches, and they seem to be growing in popularity. And this is just another way that the tobacco and vaping industry are trying to addict that new customer base for them.
So just quickly on that, Alecia, sorry. So these companies have created vapes and nicotine pouches, and they've advertised them to young people. Have they done this in the hopes that they will get addicted and then progress to cigarettes, or what's sort of the aim here?
Look, I think the aim is to ensure that they don't lose a customer base at all. So whether a young person, I think, is smoking their traditional cigarettes or using their nicotine products, I don't think that's as big a concern to the industry that are behind. They just want to sell as many of these products as possible. What we have seen, Gen Vape looked at young people who vape and haven't smoked yet, but the findings there show that if a young person who hasn't smoked yet and vapes first, and if they do vape, they're 5 times as likely to go on to take up smoking. And so that's where we're really concerned, because we've done, Australia really has done the hard yards when it comes to tobacco control, and that's where vapes, if they're hooking that generation into nicotine and then they're going on to smoke as well, we're really undoing all of that hard work from previous generations.
Yeah, okay. So the tobacco industry has pivoted from cigarettes to vapes, and then now they're already promoting the next product, which is oral nicotine pouches. Is that right?
Yeah, and look, pouches aren't a completely new product. Those pouches have been around, I would say, for 20 plus years. What has changed is the way those pouches are manufactured. They've actually been illegal to sell in Australia for 20 plus years, but they can be used. Traditionally, they were used using a tobacco variation. Now they're a synthetic nicotine. And so that's more going down that route around vapes. They come in sleek packaging. They have flavours, fruit, mint, and they've got other ingredients such as sweeteners and pH adjusters. These sorts of things we're really concerned about, because we don't know what that impact is going to have on health. because a lot of the studies that have been done on pouches previously have actually been funded by the industry that makes them. And so there's a vested interest in those studies, of course.
Yeah, wow.
So, yeah, it's a newish product to the market. Definitely the way they've been marketed is very new, and it's on the rise. So globally, they're using social media marketing influencers and things like that to try and get these products across and into a new demographic.
Yeah, wow. And that leads really well into the next question, actually. I was going to ask you, with this marketing online, what type of content are young people actually seeing when they're on social media?
Look, the marketing can come in a range of forms, and sometimes it can be really obvious with branding or sponsored posts, or sometimes it's a bit more discreet. So it can be using influencers to talk about quitting smoking, for example, or quitting using a vape product and using a pouch to do so. Things like that are a little bit more hidden into those messages for young people. We know that there are videos around showing how to dismantle a vape, how to make your vape battery last longer, how to conceal use. All of those things are really, being driven because of the discreet nature of these products. And then the content undermines all those, important public health messages that governments and non-government organisations like Cancer Council are trying to put out to people. The fact that, as you would have talked about in episode 1, it's linked to risks of seizures. There's impacts on brain development in people under 25. It can exacerbate mood disorders. Things like this are really important for young people to understand. And those sort of online social media content posts and videos, they can't go into that explanation for young people. I think there's also quite a bit that sort of that inherent role around branding and how brands can be used. So, for example, the Netflix Formula One documentary, Drive to Survive, Buse and Vive, two vape and nicotine pouch brands, are key sponsors and have their branding all over those Formula One cars and are associating themselves with that popular sport and with that inbuilt content. And so, we used to see Big Tobacco do this all the time for things like AFL and Formula One and things like that. So it's just a pivot to using that sort of same content to drive that brand recognition.
Yeah, wow. So it sounds like these companies, they sort of have a popular playbook of what they've done with cigarettes, and now they're just pushing the same thing with the vapes and now the oral nicotine pouches. So
That's exactly right. They wrote that playbook for them there. So they're just using that same playbook all over again.
Yeah, definitely. So then one last question about the online content. Personally, I don't see any content online on my algorithm about anything to do with pro-vaping content, and I know some of other older people around me haven't seen it either. Is this marketing specifically targeted towards young people?
Look, I think, in Australia, tobacco companies and vape companies themselves aren't able to advertise on social media. However, globally, we know there's a lot more flexibility around those regulations. And so most of us would know that it's not like teenagers are only following, Australian influencers or Australian brands on those platforms. So undoubtedly, the tobacco content will come via some of those global brands. And as we know, for example, an influencer getting ready for a music festival overseas who's sponsored by a vape product, they might showcase that product throughout their clip. That could end up in the feed of any young person following the music festival, the influencer themselves, or any of those sort of hashtags or algorithms that push that content to a young person demographic. So it's definitely coming through from that branded content element. And, there's just so many ways that young people engage with social media and various brands and content on a daily basis. And so that's why they'll be seeing a whole lot of similar content, and all they need to do is click or engage on that piece of content for a little bit longer, and they'll get a whole lot more sent their way.
Yeah, definitely. So even though we have laws here in Australia, there's no borders on social media, so people can be seeing things from all over the world. So Rachael, how can this be happening a little bit? So we know that we have these laws on the advertising in Australia that are banned, but can you go a bit more in depth into sort of what that all means?
Yeah, so we do have world-leading laws restricting vape advertising here in Australia, which is really encouraging. But the online world, as we all know, and Alicia's just alluded to, is that, the online world's really hard to monitor. And laws are only ever as good as our ability to enforce them as well. So we've worked really hard to raise awareness around just the sheer volume of advertising or content on platforms like TikTok or Instagram, where we know that they're seen to be glamorizing vaping. So we see things like product giveaways, we've got branding, the look of the product itself, and the general way that social media allows even the unpaid content to be amplified and pushed out. That's all working against young people and any resolve that they might have to quit. So if a friend posts content with a vape and the content has high engagement, similar content will be pushed to them further. And Alicia's just touched on all of this. So we see that constantly. And media companies like Meta and TikTok have community and advertising standards, and they prohibit nicotine products, content or advertising. But like we know and we just spoke about, it's really hard to enforce. So if you see content on Instagram promoting vapes, you can report it as a breach of the community and advertising standards. And we here across the public health community, agencies like QUIT and Cancer Council, we're holding social media platforms, influencers and brands here in Australia to account and to do more to keep our young people and online communities safe. And we're going to continue to do that until we see better enforcement of the laws.
Yeah, great. And Rachael, in our last episode, we spoke a little bit about the mislabeling of vapes. Can you touch on that a little bit in terms of like the industry perspective and why they might be doing this?
So a lot of illegal or non-therapeutic vapes, they don't state that they contain nicotine. Some of them will even go so far as to say they're non-nicotine vapes, but we know that the majority of them do, and often they're at really high strengths. And so it's because of the marketing techniques of the tobacco industry. Many people believe that nicotine-free vapes are somehow safer, but in reality, all vapes are harmful, whether they contain nicotine, because they still contain up to 200 plus toxic chemicals. So when a person purchases a non-therapeutic or an illegal vape that's labelled as nicotine, unknowingly they could be exposing themselves to this drug and may also be experiencing addiction.
Yeah, okay. So, Alecia, I'll throw this one back to you. So, over the past few years, the laws and regulations on vapes have changed a lot, and this has been confusing for a lot of people. So, as of right now, what are the current laws on vapes in Australia?
That's right. Over the past few years, there's been a lot of debate, there's been a lot of media coverage and policy change, and that can be really confusing for the average person to try and navigate. To put it simply, in Australia, all vapes are illegal unless they're accessed through a pharmacy. So if a person needs to access vaping products to quit smoking, they can do so legally at a pharmacy where they can purchase vapes over the counter in most states and territories, or in states where it isn't available over the counter, they can speak with a GP to obtain a script. And people under 18 require a prescription from a doctor at all times. So the vapes that are available through pharmacies will come in plain packaging. The flavours are limited to mint, menthol and tobacco. And that's to reduce the appeal and to ensure that the product itself can't be used as a form of advertising to other young people and drive that sort of social normalisation of use. It's also illegal to advertise any vaping products in any way, and our frameworks have been strengthened to cover, as Rachael said, all platforms. And that includes from a pharmacy perspective as well. And those laws are some of the strongest in the world regarding vaping. So, Australia has really learnt, I think, from approaches in places like New Zealand and the UK, where they've seen different approaches with different results. And so that's where we're trying to make it work the best that we possibly can for our young people here in Australia.
Yeah, great. So, Rachael, a big part of these new laws is now the pharmacy sort of model. Why has Australia sort of gone through this route rather than, I suppose, with cigarettes, you can still go to a tobacconist and buy them there? So why in Australia do we access vapes legally through a pharmacy?
So there is a difference between young people who've never smoked cigarettes accessing vapes and smokers who are looking to quit accessing vapes. So the therapeutic vape, we know, has met certain safety standards. It's supplied under supervision of a health professional, usually a pharmacist or GP. And therapeutic vapes, as Alecia mentioned, are only available in mint, menthol or tobacco. And they're really designed to be able to support somebody who's and wean somebody off smoking with dosages of nicotine reduced over time until the patient is neither smoking or vaping. So they're really designed as a smoking or vaping cessation aid. All other vapes that are bought or sourced illegally, they're entirely unregulated. We've heard of things like exploding vapes and causing major face and leg injuries when they're carried around in people's pockets. There's concerns around the oral health and the range of flavours and frequency with which some people vape. And it's often not declared if they contain nicotine, as we've just spoken about. And then, so we really don't know how much people are actually taking on when they do take on these illegal vapes. So we've got proven and effective and really safe ways to quit cigarettes, and these include things like nicotine patches, gums, lozenges and mouth spray. And these products have all gone through rigorous testing. They've gone through randomised control trials. So we know they're effective. So vaping is not the only way to be supported to come off and to quit cigarette smoking. So the prescription model of vapes was created so that smokers can look to quit and to access another tool, those being therapeutic vapes at the pharmacy, while simultaneously we're looking to protect young people from the harms that are associated with these illegal vapes that we see on the streets.
Great. So it's the main thing is about the access. So protecting young people who have never smoked from accessing these vapes. Yeah, great. So Alecia, I know that these laws or some of the newer ones were only implemented late in 2024, but are there any signs that sort of can speak to their effectiveness?
Yeah, look, we are seeing, as you say, it's a short window of time that we've been working and that these laws have been active for, and it will take time to come into full effect with the power of enforcement. But we know from recent data through Gen Vape that the proportion of young people who have never vaped has increased from 83% in early 2024 to 86% by the end of that year after that change came through. And so that's a great early sign that fewer adolescents and young people are even taking up vaping in the first place. And additionally, fewer adolescents say that they would vape if a friend offered them a vape, and nearly half agree with the premise around that a prescription is needed to access a vape. And that's really important because, you know, those laws have taken some time to come in, but they've also been talked about, and there's been, small incremental changes as well. So it's good to see that young people are getting their head around what those laws are now as well. But importantly, I think the laws aren't just limited to young people, and the impact of those laws aren't limited to young people. We also looked in March of this year at parents and teachers using that same data, and the proportion of those parents and teachers is also reaching at the higher rates in terms of non-vapor status, and that's great to see. And I think the most important thing that we've seen over the last sort of 18 months in general is that teachers, whilst they've always been knowledgeable around the harms of vaping, that has slightly increased. And most importantly, parents' knowledge has increased significantly. And, when you think about it, when these products first came out, these were products that parents hadn't used in the first place. So they were learning about it from their kids. And that's not always a good thing, because kids will tell them what they want the parents to know about these products. And so now we're actually seeing that parents have gone on to learn their own information around it and increase their own understanding and awareness. And they've done that through credible health advice, through organisations like Quit and Cancer Council and government organisations have been putting that out there. So more parents now agree that vapes are unsafe. They understand the health impacts of those products as well. And so all those signs together are, very early positive signals to suggest that those new vaping laws are having a great positive impact. And it's crucial to ensure that those trends continue. So parents and teachers are essential in being allies in this effort, and their high levels of support for these laws are a strong indicator of effectiveness as well.
Yeah, so great. It sounds like overall the general knowledge on the harms of vapes has increased, which has then led to sort of a decrease in either the social acceptability or even uptake of vaping.
That's right, yep.
Yeah, great. So, Rachael, what are some of the challenges of the implementation or regulation of these laws here in Victoria?
Yeah, there's absolutely no doubt that we're facing challenges here in Victoria around illegal sales, both of cigarettes and of vapes. One thing we are looking forward to is the introduction of a retail licensing scheme here in Victoria, which commences on the 1st of July. This is going to help us know what retailers are selling which products, and it will compel sellers to do the right thing. So we really anticipate, with the increasing enforcement around this retail licensing scheme, we expect to be able to expose those retailers who are doing the wrong thing, and to be able to enforce these laws with a lot more strictness. Victoria is the last state in Australia to introduce a retail licensing scheme. I think, it's been very frustrating for us here in the public health community to see that, but we also are very hopeful about what that means in terms of taking the learnings from every other state and territory and being able to apply those learnings to implement a really robust scheme here in Victoria. And what we really want to see as a consequence of that is fewer shops that are selling harmful products, including cigarettes and vapes, and we know that this is going to help people to quit and to stay quit. So, I think we really, whilst we are facing challenges, we're hopeful that we're going to see better enforcement in the near future.
Yeah, great. So, Rachael, what can the listeners do to help protect themselves or young people that they know from these harms?
So we know everyone, even listening here today, they're on the right track. So for young people and parents, it's really important to seek information from trusted sources like GPs, government, and trusted health organisations like us here at Quit. And it's really important to use your critical thinking skills and ask questions like, who's selling these products? Why are they selling them to me? What's their intended purpose, and how's it going to benefit me? For young people, don't hesitate to reach out to your parents, your peers, teachers, and sort of those trusted people in your life for support. And it's really crucial to hold retailers accountable for illicit vape sales. We need to support laws that restrict the sale of vapes to pharmacies and ensure that these laws are enforced. And you can do so by reporting a retailer via the TGA website or reaching out and reporting at a state level where you can.
Yeah, great. Just my last question for you, Rachael, as well. What resources can Quit provide for anyone listening?
So we've got Quitline, which is a really great place for anyone who wants support, advice, who wants to sense check on quitting smoking or vaping. And that can be for yourself, or it could be for a loved one. We've had everyone from school teachers, parents, siblings, friends, all calling our Quitlines, wanting to know what to do about a young person in their life who vapes. You can call Quitline on 13 78 48. Our service is free. It's confidential. There's confidential telephone counselling services available. We work with young people, with LGBTQI plus communities. We have Aboriginal counsellors online ready to talk with Aboriginal people. We've got translation services. So we're really ready and available to be able to support people who have got concerns about quitting. You can also visit quit.org.au. We've got wealth of information there. It's got quitting tips. We've got a story bank featuring people of all ages and background that details their own pathway to quitting. And we've got specific vaping information for parents and caregivers of teens on a site called vapingfacts.org.au. And you can go there to learn about the harms of vaping and how to have a conversation with the young people in your life. And I guess my number one top tip there is to ask open questions and stay curious.
Amazing. So yeah, all of those resources will be in the show notes below. And yeah, thanks so much, Alecia and Rachael, for joining us and sharing your really valuable insights in this topic.
It's a pleasure.
Thank you.
Thank you for listening to this episode of the Escape the Vape podcast series. In the next episode, we'll be speaking with Riona Taylor, who is an alcohol and other drugs clinician who supports young people quit a range of substances. Also joining us will be Sabine Ostrobski, the Quit Victoria State Manager. We'll chat about how we can support young people to quit, or better still, never start vaping. If you are looking for more information on the harms associated with vaping, visit the DPV Health website at dpvhealth.org.au/escape-the-vape/. The link is also in the description. The website has a host of resources for young people, parents, educators, and the wider community, as well as links to support services. If you are looking for any support with your quitting journey, Quit is here to help. call 13 78 48 to speak with a friendly Quitline counsellor.